The topic of today's presentation is healthcare bed. It's on based on the project on which I'm currently working. So, as you all know, the guide for this project is again Professor Frank Schrödel. So, I would like to start with the presentation now. So before going in detail regarding the topic, I would like to first give you a brief introduction regarding the German healthcare system. So currently, what is the situation? The current situation, even in this pandemic, even before this pandemic also, the situation of the German healthcare system was that it was lacking medical personnel. Yes, medical personnel, in fact, the nurses and the staff which can take care of elderly and which can take care of. So there are not many personnel. They are not in great numbers, not in huge numbers to serve each and every patient out there. And so this was a problem even before. This is a problem still now. Even the hospitals present there, they are understaffed, and nurses which are currently have too much of workload to bear upon themselves. Currently, this was a number which was been predicted in around 2015 that by the year of 2060, Germany will require around 3 million nurses. So this is an information that I got from Deutsche Welle article. They had shared this information, the predictions, and similarly, due to this lacking of nurses, even in this pandemic situation, there has been an issue that due to which the ICU beds needs to be blocked because there are no nurses to take care for after them. Currently, as per the number, it's like in the day there are around 2 to 2.5 there are around 2.5 to 3.5 beds per nurse, and in the night it goes to around 1 or maybe 2. So that is the dire need of the that is the situation wherein we can you can get how many nurses are required in Germany. So the main topic of my main reason for explaining you this slide is that if we can if we can bring out a product in market which can help to reduce the stress borne by the nurses and also cater to the patient needs, that will be much more beneficial for Germany as well as for everyone. And even in those areas where these problems do exist. So currently, I would also like to highlight you to one more problem as to why such product has not come yet in the market. As in, there are many market barriers for this medical devices. In order to gain a foothold in a proper foothold into market, only CE marking is not required. Actually, there are few factors which play a role in prohibiting these devices to make an introduction into the market. So one of the factor, okay, I will just go one by one. Health reimbursement. So as we all know, each and every one present here has a health insurance in Germany. Most of us will be having a public health insurance. Some might be also be having a private health insurance. So what happens basically is in Germany, whenever you visit a hospital or when as an inpatient or an outpatient, it's like if you stay in hospital for a few days, you are called as inpatient because you use the services provided by the hospitals and etc. And if you just visit the clinic, it's like you just use the service for 1 or 2 hours and that's it, and then you again return back. That is known as an outpatient. So whether it is an inpatient or an outpatient, the services provided by the hospital, certain services you don't pay for certain services. It's like they are being paid by the insurance companies. For example, if a person has got fever and he is not able to recover within 1 or 2 days and he needs to be hospitalized, so is in hospital which he is using at that particular moment of time, which is not being paid by him but is paid by, in fact, his insurance, the company which bears the insurance. So uh, my point to make is that the product that comes into the market needs to be addressed by the insurance companies. It should be reimbursed by the insurance companies in case of any issue that takes place, or if it is used by the patient, the price has to be borne by the insurance companies. Obviously, if a person gets hospitalized and it's not possible for him to pay for each and everything right at that particular moment of time, say for the surgical operation, say for the hospital bed, say for the services provided there. So this after for the insurance companies, and so health reimbursement plays a huge role in this products. They need to know whether that product can be reimbursed by the that particular health provider, a health insurance provider. Second factor is product acceptance. Not only the product might be beneficial for a particular person, but it should also be accepted by the user. For in case it should not be that much costly, or it should fit the needs of the user. The third factor is market power of suppliers. So some of them, even in today's world, it's for example, if in the diabetes sector, or even in regarding the clothing sector of medical devices, there are certain companies which have a very strong foothold in the market, and due to which, if you enter into that particular segment, for example, to the medical clothing that is worn by the doctors and nurses. So if you enter into that segment, you need to your product needs to be notarized, or in fact, I can say it will be judged by those companies. And if those companies, and if you don't have the seal or the bearing of those companies, for example, there is a company who has a seal mark called as RAL certification. So that is very important in Germany for certain products. For example, of cannulas. If you take a cannula, it's a syringe type of instrument, or even for stockings, compression stockings. So if you enter into that particular segment in that market, then if you create your own if you devise an innovative stocking, then you need to your product needs to be certified by the RAL. Product needs to have the RAL certification. So that is the power of that German market in the medical sector right now. Then there are segment communities. Segment communities is nothing but it's the strength a particular community has in the market. For example, 15 years ago, in diabetes sector, the diabetes sector was the market was very short. It's like there were no many professionals present in that sector a long time ago. Right now, and even not only it was lacking professionals, but still the companies which could bring any innovations in that particular diabetes sector, they were very few, and the market was over by those companies. Change in law in the German laws in the government, then new companies could enter into the market and could bring more innovation into the diabetes sector. And the last one is the product quality, so which is at most important. It's like if a product that has been introduced into market, it does not meet the required quality or the mark, then it cannot serve the patient as required. So it has to be upgraded each and every time. So Right now, the project on which I'm working is regarding hospital bed. So, as I told you in slide one, we saw the problem that Germany is facing. There is a shortage of nurses, and for each nurse has to attend to minimum 2 to 3 beds per day in per shift. So if there is a product which can ease out the problem of nurses, for example, if we can build a medical bed which can address the daily needs of patients. For example, if a patient is hospitalized, but the treatment is over, and now he just needs a nurse to look after him for his daily activities. So if he needs a nurse at his home or at his room for looking after his daily activities, for example, take a bedridden patient who is who stays on the bed for the whole time, who cannot move without any external support. So there needs a nurse to be blocked for that particular bed. So if we are able to build a particular that the patient itself is able to cater to his or her own needs by himself, but in such a way that the operation of the bed is such so that the patient can address his needs by himself, then it will be more beneficial, so that we can reduce the blockage of that number of ICU beds or that number of medical beds in the hospital. So if a nurse doesn't need to address to that particular patient, as in he's been taken care by the functionalities of the bed himself, then the nurse can even cater to other patients as well. So this is the main theme behind designing such a hospital bed, which can provide so many functions, so that the patient can carry out his daily activities as usual, as if he were a normal person. So the one point is addressing the needs of the care workers. Obviously, it is addressing the need of the nurses. We are reducing the load on the nurses by building such a product. It should comply to the requirement of patients. Yes, if the movement provided in the beds, if they are not swift enough, or they are not smooth, there are not smooth movements present in the bed, then that can be a drastic situation for the patients as well, and ease of market access for the companies. So this product has to be ensured that it can be insured by the insurance companies, or at least it has so many safety factors that it does not there is no obstruction for it to enter into the market. So here are some of the features which should be present in the bed from the point of view of safety. The first photo that you are seeing in figure 4 is known as CPR, which is known as cardiopulmonary resuscitation. This is given to the patient in heart attack, and if he is facing any breathing problems. So in that case, the patient needs to lie down. The ground level, the height should be completely zero. And this is the other picture that you are seeing in figure 6. This is known as Trendelenburg position. It is nothing but an inclined position. It is in this position helps the patient to reduce the effect of blood pressure present in the body. It's like helps circulating the blood throughout the body from head to toe. So if there is a patient who has high or low blood pressure, then this problem can be addressed by this position. So a bed should be able to the person should be able to incline the bed at around 10 to 15 degrees, so as to address the needs of reducing the blood pressure, as well as when the time comes, the bed should also the height should be reduced to the ground level, so that the patient could be addressed by CPR, by a nurse or anything. So these are some of the features, and figure 7 provides you an image wherein there are some obstructions. There image pertain. This image is released by the US FDA guidelines, Food and Drug Administration guidelines, that the side rails that you see, the side rails in the bed, how they should be designed in such a way so as to prevent any obstruction or life-threatening event to the patient. For example, in Figure 5, I don't know if it's visible for you. In Figure 5, if you will zoom into the image, you can see a person's head is being obstructed by the side rail. So issues due to this, sometimes even it leads to death of the patient. So current status, this slide shows the current status of the project. So currently, I've tried to design the bed as I tried to make the design as much simple as possible. So currently, I am in this phase, in the design phase, wherein I have I'm using a scissor mechanism, which can be used for lifting the bed vertically and also for providing the inclination required for the Trendelenburg position. So here we can attach stepper motors which can bear the load and also raise the bed slowly but steadily. So currently the design is not yet over. So right now I'm in the design phase and I need to complete the design of the bed frame, which you can see here in this slide. This frame is not yet complete. I need to design it so that I can include as many functions as much possible, which need the support of the bed frame. And then there will be design of bed plates wherein the patient can rest. Then I'm also thinking of designing an inbuilt toilet system wherein the patient doesn't need to stand up and make any movement. It's whenever he needs, whenever he has the urge of urinating or going for an excretion, then the the bed should have such a facility that he can perform that particular domestic activity in even in the resting position, even in his rest position. So I'm thinking of building an inbuilt toilet system in the bed. After designing, I need to work on the Arduino programming. I'm thinking of using Arduino in this project for controlling the electronic parts and the motors and everything. So from October to November, I'm thinking of carrying out 3D printing of CAD parts and also simultaneously working on the code. Then there will be assembling and making electrical connections, assembling of parts and attaching motors and everything. And in February around, I'm thinking of going for testing. So these are the references which I've used for for making my slides. And yeah, thank you.